The Health and Social Care Act, which came into force this year, has brought one of the biggest changes to the NHS in its history. Some GPs, like Dr Patel, who works in East Grinstead, are now in control of their own budgets.
The benefit is that you have a membership, a very wide array of GPs and other health professionals within the community who are able to use their clinical knowledge and their experience to plan and improve services at a level that actually hasn't existed before. You know, we've not had this level of clinical involvement and engagement in commissioning in the NHS ever.
But not everyone is happy. Gareth Tomlinson is a member of an NHS patients group covering West Kent, who are there to keep an eye on the changes.
My concern is that as a patient, I'm being sold by the government the idea that this will actually improve patient choice and improve quality of service and bring down costs in the NHS, none of which I believe is true.
So what does Gareth think is the problem? Well, he thinks the most worrying thing about the new Act is the new system of clinical commissioning groups. GPs and other health professionals have been organised into these CCGs, as they're known. They have access to money to buy some services from private companies, services that could be provided within the NHS, things like ambulances, hip operations and district nursing, for example. Some health experts like Roy Lilly are not happy with Section 75 of the new Act. It's a bit which lays out exactly how CCGs should put services out to tender.
If the cake was the NHS, Section 75 is the knife, effectively, that allows it to be cut up and sliced.
And Roy says slicing up the cake and giving bits to the private sector is a bad idea.
The NHS is a whole cake. It's what we call an integrated service. It's a whole system. If you carve a piece out of the cake, however tempting that is, you've still got to put it back in to make the whole system work. Where you put it back in, it creates the two edges where you cut it. That's what managers call a service interface. What that means is where services join up is where you'll get the problems. You get communications problems, you get arguments over funding, who does what, and if that bit of the cake goes broke, then you've got an even bigger problem. The holy grail of the NHS is integrating services, joining them together, not breaking them up. And when you break them up and put them in the hands of different operators, however good they are, you create more service interfaces, more costs, and more possibility for things to go wrong.
David Worsgett runs an alliance called the NHS Confederation, which represents some private healthcare providers. He says there won't be a problem with expensive administration of the new system.
Well, that's a very minor point, and it's largely irrelevant. I mean, the interesting thing about the NHS over the last couple of decades is how poor it has been as an almost entirely state-run system. And don't forget, even with these reforms, the independent sector is only delivering about 5 or 6% of NHS services, and that probably isn't even going to double over the next decade. So let's keep this in perspective.
The man who is ultimately in charge of the NHS is the Secretary of State for Health, Jeremy Hunt.
What will the cost of the reorganisation be? And in terms of admin, how much will that cost?
Well, as I say, I can get you the exact figures, but net, that reorganisation is saving £5.5 billion over the course of this Parliament, and that means we're able to employ more people on the front line, 4,500 more doctors, 400,000 more operations every year, 1 million more people going through A&E, and that's why I think they've been a success.